Okay, we'll start with the female. And when I look at a model, I like to have a landmark. And so for me, the landmark is the uterus. And I think of U for uterus because it's like U-shaped but upside down. And so this is where the ovum is going to implant, and then the fetus is going to grow, and you can just imagine this uterus swelling and swelling and swelling. It's a nice, safe place for the fetus to develop in. So one of the problems for the mother, though, it's perched right above the urinary bladder. And so as she progresses in her pregnancy, you can imagine the pressure on the urinary bladder, and then you can kind of understand why they have incontinent problems with frequent urination, because there's just no there's no room for urine in that little tiny chamber. Okay, so if we follow the uterus down near the tip is a region that's really rapid cell division called the cervix, and that's why sometimes an osculum is used and a little scraping of the cervix, because if there's going to be cancer in the uterus region, it's often in the cervix, right at the tip. And that in the old days it was every year, but insurance is making it like every 2 years. But that's the cervix, and then following it down is the vagina, which is a really muscular and gland-lined chamber, very different than the rectum. Okay, sometimes on tests students confuse the rectum for the vagina, but the tissue is very different. So vagina, find the uterus and you found the vagina, pretty easy. And then there's the rectum there. Near the end of the vagina is the labia, and then the clitoris, which is where erectile tissue, sort of like a penis on a man, because it's going to engorge with blood and stimulate nerves. Here, the urinary bladder, we just follow it down to the urethra, and this is one of the reasons that women tend to get more frequent UTIs than men, is the proximity of the anus and the urethra. And that's why we always teach our daughters when they're very young, you wipe from front to back. So you never, not from back to front, to reduce the risk. Here, if you see back here, is the ovary, which we're looking at under the microscope, and then the fimbriae are these little finger-like projections that are going to sweep over the ovary and pull the ovum down the uterine or fallopian tube. Fallopian's the old name. And then look where it's connected, right to the uterus. Right. For the male, for me, the centerpiece on the male is the prostate. And here it's in purple. And the prostate is perched right below the urinary bladder, which is kind of unfortunate for guys, because what that means is as we age, that prostate goes through what's called hyperplasia. It's going to swell and it starts to strangle the urethra. And so when a man's young, he urinates like a horse. It just comes right out. He stands up and does it often. But as a man gets older, it kind of dribbles out and he has to pee frequently. And that's why for a man, really, he should sit. When he gets to a certain age, he should just sit and urinate. Because, sitting, you can empty your bladder better. And okay, so there's the urinary bladder, the urethra, surrounded by the prostate there. And then following down here is the testes, which we're looking at under the microscope, where the sperm is made. And there is the epididymis, where the sperm mature. Now, this is where a lot of testosterone is produced, but some is also produced in the adrenals. That's why women have testosterone, right? Like, women don't have testes, but they still produce testosterone because it's in the adrenals. So this is not the only place where testosterone is made. If you look at the penis, that's erectile tissue there, and that is the main way that erections occur. Okay, so all these devices that guys use to try to increase their penile size is really ridiculous, because if there's blood flow, there'll be erections. If there's not blood flow, if the man's worried or scared, it's just not going to happen. Okay, so it's good to always make your man feel safe and loved. Okay, we need it too. I'm telling you. At the tip is the glans penis. We can see it a little better this way. And this is where circumcision is done, and that's where a part of the glans penis is cut away. And that reduces the risk of urinary tract infections, UTIs, and possibly cancer, we don't know for sure. Now the old technique was really severe, where the head of the penis during erection is like really tight like a drum. The newer method of circumcision gives a little more skin there, like the foreskin it's called. And but there's debate. Okay, some people say no circumcision. So I'm not going to try to sway you on which way to go on that. Rectum back here. Seminal vesicle is kind of hard to see. That is part of the a little gland that's going to give nutrients for the sperm, because sperm, they have almost no energy reserve, okay? And they have a long ways to swim. And so the prostate and the seminal vesicles are going to provide nutrients in the semen so the sperm can kind of survive and do their swimming. And sometimes a man has a extraction of the prostate, if he has prostate cancer, and then that can be a problem sometimes. He tends to gain weight, but if it's cancer or gaining weight, you want to get rid of the cancer. I think that does it.